Hello everyone and welcome back to the Heart Guardian podcast for Healthy Heart. I'm your host Dr. Aman Kapoor. Today we are talking about something truly fascinating. How nuclear medicine can help us take care of our hearts. Well, this might sound complex, but don't worry. It is all using advanced technology to get a clear picture of what is actually going on inside our hearts without any invasive procedures. To help us understand this better, we have with us Dr. Jagdish Hiramat. Hiramat sir, welcome back. Can you please explain in simple terms what nuclear imaging is and how it helps doctors and experts like you to diagnose and treat the heart problems?
Nuclear medicine and heart. A cardiologist needs a lot of information related to the heart to make correct diagnosis of various ailments and plan treatment accordingly. Nuclear imaging of the heart involves a radioactive nuclear tracer. It is injected in the body through a vein. As it travels through the blood and spreads in the heart, a special camera, the gamma camera, takes pictures. Thus, it's a non-invasive test where our body is not invaded by tubes or probes. The gamma camera can pick up areas that are highlighted by the nuclear substance. These images are interpreted by nuclear medicine experts. They are trained physicians who have specialized postgraduate training in nuclear medicine. They handle the radioactive substances also. Nuclear imaging is used for all parts of the body, but the heart, it can bring a powerful niche information and help cardiologists plan precise therapy. The first case that I would like to discuss is a fairly commonly discussed occurrence in heart patients. Mr. T, otherwise a normal individual, underwent routine checkup at the age of 40 as a part of its company checkups. The treadmill test, the TMT, was abnormal. The abnormal treadmill test indicates blockages in the coronary arteries of the heart. Mr. T underwent coronary angiography and he was found to have a 60% narrowing in an important artery. At a young age, there was a dilemma whether to provide preventive care or subject him to angioplasty with a stent. In short, the importance or the significance of this narrowing or the lesion, which was 60%, was being debated. A less than 50% blockages would have been a straightforward decision not to do anything, and more than 75% would have been a clear angioplasty. Such a borderline blockage churned a lot of muddy water. Nuclear imaging was used to solve this dilemma. Mr. T again underwent a treadmill test as before. At the peak of this walk on the treadmill, when his highest heart rate was achieved, thallium, a nuclear radioactive substance, was injected in his vein. The thallium reached the heart and spread along its blood flow in all three areas of the heart. At this stage, gamma camera, which is like a scanner, took various images in various slices of the heart. Heart, a three-dimensional structure, is interrogated in a two-dimensional modality. This done, Mr. T was made to come back to the nuclear medicine department after 4 hours. By this time, the thallium got stabilized in the heart and gamma camera repeated the series of images. This takes a few minutes while the patient lies down quietly. The nuclear physicist now compared the two sets of images and gave the cardiologist the final impression. If the thallium lights up an area, it is called hot, and if it fails to reach that area, it's called cold. Mr. T had all areas of the heart hot in both the images, which was after the exercise and in resting. If Mr. T's block was important, significant or causing flow restriction, the area supplied by that artery would have been cold in comparison to the brisk flow observed in the other arteries. At 4 hours, the blood would normally finally reach, get redistributed and would become hot. In technical terms, the ischemic area, that is the area with less blood flow, will remain cold at peak of exercise, because of the high heart rate and work done by the heart. It will slowly become hot in the next 4 hours. In Mr. T's case, it never remained cold to start with. It was inferred that 60% block was not important. It did not require any mechanical treatment like the stent. Mr. T was advised only preventive treatment. The thallium TMT was a game changer. Mr. T went on to become the CEO of the company in the next 10 years. He repeated his thallium test 3 times in 10 years, all the time proving to be normal. The normal TMT raised a suspicion. Coronary angiography gave a borderline verdict, but the thallium provided the correct direction. We commonly say that the TMT is the session court, thallium is the high court, and the coronary angiography is the supreme court. Another use of thallium, like radioactive agent, is to check viability of the heart muscle. The heart muscle cell, the myocardium, is an active living cell. It produces glucose, energy, and all this is known as metabolism. If the metabolism is going on, the myocardium or the heart cell is living or viable. If it is dead, it will not metabolize, and the radioactive substance will not reach the myocardium. The cell activity takes it up actively by metabolism. Thus, the cell becomes radioactive, hot, and is captured as a lit image on the gamma camera. If it is dead, thallium will not enter the cell, and that area of the heart will be cold, unlit by the gamma camera. Another case I must discuss was when we were asked to evaluate a patient who had multiple blockages in the arteries and a weak heart which was sent for a bypass surgery. Turns out that the PET scan of the heart was non-viable, that is dead. The bypass surgery would be of no use. It would be like watering a dried plant. This person underwent a heart transplant instead of the bypass and now is well for the last 3 years. The other way around, a poorly pumping heart was relegated as end-of-life treatment and was found to be very viable on the scan. A single crucial angioplasty turned the tables on this person, and now he runs a half marathon. A 24-year-old lady came to us with a blood pressure of 200 by 110, alarmingly high. She and her doctors had been struggling with it for the last 6 months. Career, marriage, pregnancy, all were on hold because of this volatile blood pressure. We subjected her to a PET scan. To our pleasant surprise, a tumor, pheochromocytoma, was detected at one spot in her body near the right kidney. She underwent the tricky but effective surgery of removing this tumor, and the blood pressure vanished, and now she is a happy mom with 2 kids and a stable job in the bank. Thus, nuclear medicine has come of age. It forms a turning point in decision-making in cardiology in about 15 to 20% of all cases. It's a non-invasive, safe modality, and for the information offered, it is highly cost-effective. I, as a cardiologist, feel privileged to be practicing in today's era of this advanced technology. I've seen the transition in practice. Without nuclear imaging, clinical decisions were made on gut feelings and experience. They were all well-intended but had been subjective and could have an element of error. Nuclear imaging has added remarkable objectivity to decision-making, and this transition of using and not using nuclear imaging leaves me Twitter-patted, excited.
Wow, that's quite exciting and quite interesting to understand, Dr. Jagdish sir. Well, thank you so much for explaining nuclear medicine to all of us and to all our listeners here. My dear friends, what do you have to say about nuclear medicine? What do you think about it now? Make sure to drop a comment, especially if you're on the Spotify. Drop a comment below and let us know what you think about it. and take care of your health and your heart so that you remain healthy. Till the next time, this is Dr. Aman Kapoor signing over and out, wishing you a great health. Bye-bye.